We're going inside to meet cosmetic dentist Dr. Weiser right now. Dr. Weiser?
Hi, Randy. Welcome to the office.
All right. Well, I'm glad we finally made it here.
Great. Come on in. Let me show you around.
Okay. Now, this is your waiting room, obviously.
This is my waiting room, and here's our lovely staff.
Lovely staff. How are you?
Marie and Alexandra. Upstairs we have a little lab and a staff lounge where we can...
what do you do in the lab?
Well, we do a lot of model work, and we do some Invisalign work up there, and setting up of the porcelain work.
Okay.
We do initial some of the porcelain.
Now, everything
design.
you do is cosmetic dentistry.
Right.
Is that right?
Right.
Okay. You know, we told people coming in here that this is what people are calling the hottest cosmetic dental practice in Santa Barbara.
Mm-hmm.
So we look forward. You have some patients lined up for us?
Yes, I do.
Okay, great. Okay, what are we looking at here before I interrupt you?
Let me show you this. This is our scrapbook that we have of the practice, our lovely staff. And this is LaVon, our office manager, has been with me for 18 years.
Mm-hmm. You did her teeth?
Yeah, we did her teeth, yes. It's a model here in the area. And
Do you have a Beverly Hills practice as well?
Yeah, I'm there a couple days a week.
Okay.
And then I work with Dr. Bill Dorfman, who's the Extreme Makeover dentist.
I think I've seen him on Extreme Makeover, that's right.
So
are you a better dentist than he is?
I can't answer that.
You can't answer that? Okay.
Mm-hmm.
All right.
And here's some of the other...
More models.
More models of makeover that we did on a young lady.
Smile.
Yeah, we treat all ages. That young gal like that had a small teeth, and so we wanted to enhance her smile, building them out a bit. And here's a couple of other
cover
patients.
Of Santa Barbara Magazine.
Patient on the cover of Santa Barbara Magazine.
Thanks for keeping my teeth skinny.
Right.
What does that mean?
Well, that means she didn't want very large teeth.
The big veneers.
The big veneers, the overbuilt veneers.
That's what I see all the time.
Yes.
That's my impression.
It's a common problem. It's a common problem.
Is that in the hands of the dentist?
It's in the hands of the dentist.
You don't do that, you're saying?
I don't do that. Well, here's Cara, a picture of Cara and some of the work that we've done on Cara. And she's a model and currently living in L.A., but she's aspiring actress model, and she presented with many misshapen teeth and discolored teeth, kind of a mosaic of dentistry in her mouth. And she said for the work and being in the industry, she wanted to have better looking teeth.
How do the people in the industry hear about you? I mean, it seems like you have a lot of that type of clientele.
It's all word of mouth.
Okay.
Andy. It's all word of mouth.
Even in this town now in Santa Barbara?
Absolutely in this word. If it's not because of the spa services that some people really like the amenities that we offer and the one-on-one treatments that we do with them.
Spa dentistry.
Spa dentistry.
Kind of a new one for me. What is that?
It's all about patient comfort. It's providing eye pillows, paraffin wax, anything to make them feel right at home.
Got it. Okay. Okay. You're watching The Wellness Hour. I'm Randy Alvarez. We're on location today. We're in the waiting room here at Dr. Weiser's office, cosmetic dentist, and we're talking about the latest advancements in cosmetic dentistry. Dr. Weiser, thanks for allowing our cameras here.
Thanks for being here.
We're going to meet a few of your patients today.
Great.
Now, before we get into today's topic, tell us about your practice and your background and training. How long have you been involved in cosmetic dentistry?
I've been a dentist for over 26 years, but my interest peaked in cosmetic dentistry probably in the early 90s when it kind of started evolving.
Okay.
And through my interest there and other high-tech equipments like lasers, I started attending a lot of continuing education courses and at different dental institutes that have formed to teach just cosmetic dentistry.
So tell me about your special education or continuing education when it comes to learning about cosmetic dentistry.
Right. I've had a lot of training at the Las Vegas Institute. And that is an institute designated just for cosmetic functional dentistry. They teach all forms of cosmetic dentistry as well as they introduce that functional aspect of it.
What does that mean, functional aspect?
That's like the bite and how the teeth come together, because it's more than just the form of the teeth, it's the function of the teeth.
Today's topic is veneers. What's changed in the last 15 years, 20 years? Anything?
Well, a lot has changed, and it keeps changing. It's changing in the last few years. It's changed quite a bit.
How so?
The materials have changed quite a bit. They're now denser, stronger, more natural looking than they were just 5 years ago.
Because the veneers I've seen, when I see veneers anticipating this interview walking around...
And you're an expert. You told me that.
Well, I'm an expert because I interview a lot of dentists, and I feel like I can see them
walking
down the street. To me, it's not a natural look sometimes.
Right. I think what you're seeing is dentistry performed not by a specially trained cosmetic dentist.
You call it spa dentistry, boutique dentistry.
Right.
What is that?
Well, it's all about dealing with people's fears and phobias of going to the dentist. We are trying to create an environment that makes them very comfortable in coming here. Boutique meanings, there's a lot of one-on-one time. Spa meanings, providing amenities such as paraffin hand treatments and foot booties.
How important is that, though?
Well,
does it relax the process?
It's very relaxing because there's a lot of fears out there. You know, Randy, that 50% of the population still doesn't go to the dentist. Smile
design. You keep saying smile design, but what do you mean? I mean, how much role do you play in designing the smile?
I play a very big role in it. It brings out the artistry in me, and what that incorporates is the length and the size of the teeth, how they fit against each other in an upper and lower arch, how they fit to the color of the skin, the hair color, and actually the shape of the face.
Now, you have a practice in Beverly Hills.
That's correct.
With the guy from Extreme Makeover.
Right, I'm partner.
Dr. Dorfman, is that
Dr.
right?
Bill Dorfman, and a partner of mine, and his Beverly Hills practice. And I'm there.
Big celebrity practice.
Big celebrity practice. Does the TV Extreme Makeover, and BBC has a show called Brand New You that's very similar.
Okay.
And he's a very large entertainment clientele.
Were you ever featured on that show?
Yes. And how we work that is that we tag team the dentistry, where Dr. Dorfman will do some of the smile design, and I'll do some of the preparations, and he may do some of the temporaries, and I may do some finished work on the patient. So it was a team effort in creating these makeovers.
With that practice, and because of the awareness because of that program,
right?
It's now everybody's wanting to do it. More and more people. It's become mainstream.
Dr. Dorfman is America's dentist now because of that.
Now with veneers,
right.
Are the patients getting younger and younger, older and older?
I would say they're right in the middle. There's quite a range there. But I would say it's probably more so in the people that are trying to rejuvenate or refresh their smiles by maybe looking a little younger.
Okay, so the 40-plus crowd.
That's correct.
They come in, they take care of their skin, their nails down, they've got these old teeth.
Right.
Take me through the process. I mean, what can somebody expect? They come in, and you also call it instant orthodontics.
Right.
What does that mean?
That is a smile transformation in a matter of weeks. So, for example, that would be somebody that came in with crowded or spaces between their teeth.
Okay.
And in 2 or 3 weeks, we can make them all perfectly straight and in the right alignment with the right bite.
You do Invisalign as well?
That's correct.
Do people ever come in and say, I want veneers, doctor, and Invisalign is the way to go?
All the time. Less is better always.
Okay.
We're really involved with doing conservative dentistry, and many times these cases will be just a little reshaping of the teeth and moving them a little bit with Invisalign and bleaching their teeth, and not veneers. This is a consult room where we do a lot of our smile designs with the patients.
So this is the patient we're going to meet.
That's correct. This is the patient that's going to be coming in for post-operative check after we've done some work. And
what's going on with her before?
Well, she's had a lot of concerns that she presented with. Number one, the gray edges of the teeth there. She's worried about that.
Now, she looks like she had a pretty nice smile to begin with. It wasn't so bad.
Oh, it's not bad, but you wait. She's one of my consults that we're going to visit.
So she's completed?
She's completed about a month to 6 weeks out, and she can't be happier. She's smiling all the time.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We're here at Dr. Weiser's office, and we're talking to Sue, a veneer patient. Sue, thanks for coming on the program.
You're welcome.
Now, look at this before photo, and this is a dramatic change, to say the least.
It is a dramatic change.
What happened to your teeth? That looks like kind of old, capped teeth.
When I was
space in your mouth?
When I was 16 years old, I fainted and fell on my face and broke my teeth in half, and so I had 2 crowns put on the front 2 teeth. So they had been in my mouth for quite a while.
Did your teeth bother you? Dr. Weiser said they did.
They really bothered me. I think I got along a lot of years with taking pictures with my mouth closed, and I think smiling very small, not opening myself up because I was embarrassed. It was the one thing about myself that I was always really self-conscious about.
Okay, then let me see a smile. Let's take a look at that smile. And if we put side by side your before and after, it's an incredible difference. What about your personality? Any changes? I mean, do you feel more outgoing? Do you feel happier because of it? They say when you smile more, you're happier.
I think anytime you do something that makes you feel better about yourself, you feel better. So I think generally I am happier. I couldn't be any happier with the result.
It's also a very clean look.
Yes.
A very young look. I mean, you also look younger, noticeably younger. So what made you finally decide to do something about it? I mean, was there the last straw?
I just woke up one day and I was like, I'm a big girl, it's time to go take care of this. And I just made up my mind that it was something I was going to do for myself.
Were you afraid of something? I mean, were you afraid of the pain?
It was pain, yeah, definitely the pain. And I think I have memories of being a child and it just being really uncomfortable and not pleasant to be in the dentist's office.
Now, Dr. Weiser says people like coming here.
I love coming here. I think not only is he an amazing dentist, and it's been completely, if you can believe it, pain-free, but the staff here is just so friendly and nice, and it makes it like you're coming to visit friends.
I guess the scary part sounds to me, not knowing what my teeth were going to look like ahead of time. How much were you involved in, knowing what your teeth were going to look like ahead of time?
I looked at pictures and I looked at color and we discussed it, and then basically I left it in Dr. Weiser's hands because he's the expert. And
did you pick your own smile? I mean, because I see that he has catalogs.
We looked at the shape and the size, and so we picked that together, and then we discussed the color, and I went to him for his recommendations just because he's the expert. Everyone in town recommends him and loves his work. So
in this town, people say he's the guy to go to when you want a world-class smile.
That's why I was here, yes.
You agree with that?
Absolutely.
His reputation, and I've talked to a lot of his employees, but they say he really is that good. He's an artist. You see him as an artist?
Absolutely. I think it's not just a matter of doing the physical work, but it's having the artistic eye. And I think he's blessed in that area. I think he does beautiful work.
Okay, Sue, we're going to take a quick break.
Okay.
Let me see your smile one more time. Okay, very nice. Your before and after, completely amazing. So I want to thank you for sharing your very personal story here on the Wellness Hour. You're watching the Wellness Hour. We'll be right back.
We have 4 operatories that we work out of. And here's Melanie, our dental assistant of 12 years.
Okay.
And, let me show you these photos of actual patients that we worked on.
These are actual patients?
Exactly.
They look like models?
They are. They're models for me.
Okay.
They're displaying all my work.
This is a nice looking smile. She looks familiar.
Isn't that wonderful? Oh, she very well could be. We did some minor cosmetic enhancements there, and just to help broaden the smile, whiten the smile, and it looks great. And then we have Jenny, who came in. She had previous veneers done, and she had a problem with them keep coming off. Multiple veneers.
Teeth were falling off.
The veneers kept falling off.
Okay.
And that
was that in the hands of the dentist? I mean, is that a common problem in the world of veneers?
It's really not a common problem in the hands of a cosmetic dentist, because if you follow all the bonding protocols, it shouldn't come off.
You say that as if she didn't go to a cosmetic dentist or somebody that specializes in that or focuses their practice.
It's hard to say, but it appears not.
Okay.
Yeah.
Okay.
And then we have Bobby, who's was afraid to smile because she had short teeth, and a lot of gaps between her teeth, and she just
short teeth from where?
From where?
Over years? Okay.
That's correct.
So you can lengthen the teeth.
You can lengthen teeth with veneers.
Okay.
And then you can close the gaps with veneers. We did that with her, and so now she has a nice broad smile. Then we have Ganilla, who likes to smile now, and she didn't used to.
Now, these all look like model shots. Did you send them out and go get some glamour shots taken?
We absolutely did. I consider all my patients models of my work now, so I think it's important that we display them accordingly.
All right. What about this one over here behind you on the wall? I think this is my favorite.
Yeah, this is another one of our patients. She has
not a model. I mean, you did
not a model, but she very well could be.
Is that veneers or just braces?
Now you pride yourself in spotting veneers.
That's right. I could spot
veneers. Does that look like veneers to you?
No, it doesn't. It's just a healthy, young look. I can't imagine her smile was that bad before.
It's just so much more enhanced now and better. It's wonderful.
Is that your typical patient that comes in here?
I have patients from all ages, anywhere from 15 up to age 80 that want to have some
80-year-olds are coming in?
Absolutely, for some kind of cosmetic improvement.
Let's take a look at some of your work.
Good, let's do that. This is Emma, we have a picture of here, and she's in her late teens, and she never liked her smile. She had really, really short teeth and a lot of spaces between them, and she even had orthodontics, and it didn't work.
Okay.
So she was looking for other alternatives. So what we decided to do was pour some veneers to close the spaces, lengthen the teeth, and give her a more feminine look because they're very square teeth for her. So let's look at the after.
Oh my goodness.
Isn't that something?
See, she goes from just a young girl where she looks like a very pretty
she added
woman, almost.
5 years to her life and looks like a model now.
I mean, huge difference. Also the gums. Did you address the gums? It seems like she had a gummy smile.
That's right. It's another thing we do in adjuncts to veneer preparations. We also do gum lifts using the dental laser.
With a laser?
A laser.
You just...
Where we can sculpt the gums wherever we have room to make them in a more ideal position.
So what does a patient like this say to you? When you're, I mean, because it's such a huge transformation.
Right.
It doesn't look like the same person.
They're almost speechless afterwards. This is Mindy, who came in on a cosmetic consult. We've seen her once already, and she was gracious enough to let the cameras come in and film during this consult, the second consult. And we want to just kind of review some of the things that you want to have done. So how do you feel about your smile?
I'm not very happy. My teeth are discolored and chipped, and I tend to grind my teeth, so I think that they're pretty flat. I feel like I haven't smiled in 20 years. I'm always covering up my mouth or looking down, and it'd be really nice to be able to smile.
And you have wonderful, great foundation teeth, healthy gums. There's a lot of good things going on in your mouth, but there are certain things. Let me show you what we can do to enhance your situation. Look at the monitor here, and this is a similar type smile that you have. It's what we call a reverse smile, where the front teeth are shorter than the adjacent ones.
Okay.
And this typically comes from age and maybe some grinding or clenching the teeth that you do. There's some functional problem that's caused this, and this is kind of the scenario that you present with.
Okay.
And I just want to show you briefly what we can do to correct that, just through the use of porcelain veneers.
Oh my God, that's great.
Isn't that wonderful?
Yeah.
Since you have ideal tooth structure, let me show the camera a little bit about what's going on and what we can do for you. Okay? Let me have a pro, please, Vanessa. Okay. So there's many different ways we've talked about Invisalign, we've talked about whitening, but in your situation, because of the functional component, the wear and the reverse smile line, the veneers is definitely your best option. Okay. Let's take a look in there. And smile really big. I'm going to lift your lip up, okay? And there's just a few things I want to point out to the camera that we can improve upon. The front two teeth, as you can see, are worn, and we'd like to lengthen those. And in lengthening those, we also like to soften it up there, give you more of a softer, feminine approach to that. And I do like the shape of the adjacent teeth there, but so we'll probably keep a similar design to those. And if you look at your lowers, you can see the crowding, the kind of the different mosaic appearance of the teeth there. That can all be corrected with porcelain veneers. So we'll give you what they call instant orthodontics. It'll be all straight and natural looking teeth.
Oh, that'd be great.
The next step would involve taking diagnostic records of your teeth. And that's where we have molds of the teeth there that we can kind of plan out the case and really decide what you specifically need. We will then go through different catalogs of smiles. So if there's a certain look that you're trying to look for, we'll see if we can pick one out of the catalog. And as well, we might even do some imaging of the teeth there. Wouldn't you like to see imaging of potentially what it could look like?
Oh, that'd be great.
So that is an option that we do as well. So what we're going to do next with Mindy is we'll take impressions of the teeth there. We'll have picked out a catalog. And from that catalog, we'll be able to have the lab give us a wax up of the ideal smile. And you'll come back in a couple of weeks where we can do the preparation of the teeth there. And as well as the preparation, we'll be able to give you what they call a trial smile, which is the temporaries made in the shape of the ideal wax-ups. So you're going to walk out here in 2 weeks with a gorgeous looking smile, just in temporaries. Let's go down here and look at a few other photos that we have.
More of your work.
More of the work, all kinds of patient ages,
right.
Anywhere from professional businessman to aspiring actress, to housewife, model, to husband-wife. All had one thing in common, or common theme, and that is that they all were unhappy with their smile.
Okay, now this is, and I keep saying this, and I don't want to look like I'm endorsing you here, but I interview doctors nationwide, and these are some of the best smiles I've ever seen. Very good.
Because they're real people.
Now this over here, what is this? This is just a standard...
This is our state-of-the-art sterilization area. Okay. And here's Vanessa, our dental assistant of many years.
Another nice smile.
Another nice smile.
You require that to work here.
It's very important. They have to have a nice smile to work here. Okay. And she's a good model for us, too. She's an Invisalign patient that we straightened her teeth with the clear braces.
So you're doing Invisalign as well?
We're doing Invisalign a lot.
Now, people still don't like coming to the dentist. I mean, this is a nice office.
Right.
And a friendly staff.
Yeah,
but nobody likes coming to the dentist.
The ADA says 50% of the population still does not see a dentist.
Okay.
Because of fear.
Is it the pain?
It's the pain
like
or the anticipation of pain.
Okay. So what's going on in here?
This is our sedation room, where we do a lot of sedation for our patients.
Are people completely out?
No, they're fully responsive. It's just a little blue pill that they take, and it puts them in a dreamlike state.
What is this over here?
This is a nitrous oxide that we use or laughing gas.
Just like a little mask that goes over?
It's just air that you breathe. They also help relax you during the procedure.
Big
all these little things just to try to make the procedure go quicker and easier for
Big
you.
request for that, by the way?
Big request for that.
Now
Especially for long cases when you're doing full smile rejuvenations. That's a long day.
Okay.
And so that when you're doing sedation dentistry, it takes the whole time element out of it.
So you wake up with a beautiful smile.
You wake up with a beautiful smile.
Okay. Now, let me ask you this. I mean, the spa dentistry concept of, I see photos that you show me with people with gloves on and headphones on and things on their face. Again, is that in combination with?
It's in combination or by itself. The whole idea is patient comfort. We pride ourselves in providing comfortable dentistry. And the spa amenities just helps enhance that kind of atmosphere, the boutique atmosphere we're trying to provide. So these are some of the subtleties let's look at in designing a smile, what a cosmetic dentist should look at when he's looking at your smile.
That's the flatter.
This is the flatter, squarish appearance.
You say a more mature look.
And adding in the face, this is what it looks like.
It's a
more
beautiful
mature.
smile.
It's a beautiful smile. Some people really like that smile.
I like that look.
But let me show you something completely 180 degrees different.
And this is all the same woman?
Same woman, just tried on with different shaped veneers.
Okay.
So we're going to go from...
Now I like that one better.
Pretty darn round all the way around.
Rounded teeth.
First rounded teeth versus all square.
Okay.
And then you try it into with the face, and you can see the differences.
Very pretty smile.
That almost makes her look a little more feminine, a little more youthful.
It seems like all women would want that smile.
It doesn't fit everybody, and here's where it doesn't. If you look at the shape of the face, if she's got more of an oval face, then the rounder appearance looks good. But if she's got a square face, maybe that square look would look better. Let's talk about the length of teeth and how that can make a huge difference in the actual smile.
So the length of the front teeth.
The length of the front teeth. Okay. So I want to take you through these different photos here. This is one where the centrals or the front teeth are pretty much the same length.
Okay.
Okay.
Again,
now,
a beautiful smile.
And we're going to kind of slowly shorten the next teeth over.
Okay.
Okay, so we're talking about...
Oh, so the front two teeth are the same.
It's either shortening these or adding these. Okay, and the length of the tooth is basically based on a golden proportion principle.
What does that mean?
The tooth should be wide as 75% of the overall length of the tooth there.
Okay.
So that's the golden proportion of a size of a front tooth.
Okay.
Okay. So if we can, either one, if you lengthen these, so let's talk about lengthening.
Now you refer to these as length codes.
Yes.
Okay.
Yes.
Yeah, and by the way, what you're showing me is what you show a patient.
That's right.
Okay.
This is what we go through in our smile design. We look at basic shapes of the teeth there, and then we're going to talk about length. Okay, so if we add a little bit of length to the two centrals, the different lengths, you start to see that as it gets bigger.
Now, the last one. Again, very youthful.
This is your youthful look.
Yeah, and that doesn't look phony.
It doesn't look phony.
You like that look?
I like that look.
Okay.
There are some that prefer this look.
Okay.
And that's why it's so important to give the patient what they want.
Do you think cosmetic dentists are not going over this enough or smile designing enough, and that's why you get these phony looking veneers all over the place?
I think that's a lot of it. It's communication is the key to success in a cosmetic case, and you just have to spend the time with the patient to get all the needs and everything covered that they're looking for.
Okay, we are completely off time.
Right.
Keys to a good-looking smile.
In
your hands.
In my hands, it's all about the smile design, putting that smile in the patient's mouth to see if it looks right from my point of view, from their point of view, and going from there. Make sure all the profiles are correct. From straight on, we look at it from different angles to make sure that all the emergence profiles are correct, they're not too bulky in appearance, that we show enough display of teeth, that it's broad enough, the color is correct. Those are all keys in having a successful smile.
Dr. Weiser, I want to thank you for allowing our cameras here.
Oh,
very
my
interesting.
pleasure.
Very good. Good work, too.
I'm passionate about what I do, and I appreciate being able to show it off for you.
All right.
Thank you.
Thanks for coming to the program. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Well, if you would like to see this program again online, visit our website at wellnesshour.com. For now, I wish you good health.